name is Marley Reinhardt and I'm a level 2 nursing student at Conestoga, and today I'm going to be giving an intramuscular injection and a subcutaneous injection. So before we start, I'm going to pull up the MAR and I'm going to check if the patient has any allergies, and there's a confirmed allergy for codeine. So we're going to ensure not to administer the patient codeine, and we're also going to check that it's the right patient, dose, route, time, frequency, drug, and documentation at the end. Now, on the order, it has heparin for 5,000 units for subcutaneous injection, and then it also has Hadderall for 1 milligram of an intramuscular injection. So before we start our IM injections, I'm just going to identify the appropriate sites for a subcutaneous and intramuscular injection. So for subcutaneous, below the navel and the abdomen is appropriate because there's a lot of subcutaneous tissue there. You can also do behind the arms. There's also a lot of subcutaneous tissue there. For intramuscular, you can do the ventrogluteal muscle on the side of the patient using appropriate technique. And then you can also do the ventralis lateralis on the front of the leg, and you can also use the deltoid arm. Another thing we're going to check before we start the injection is the patient's body weight, stature, and build. So I'm going to go into the patient's room now. Hi, Mr. Mancini. My name is Marley Reinhardt. I'm a level 2 nursing student. I'm just going to check the area sites because we're going to be doing an injection today. I'm just going to check the area. Alright, so it looks like I'm going to be doing the subcutaneous injection in the abdomen because it feels as if there is a lot of subcutaneous tissue there, so it would be the appropriate site, and also there's no lumps and the skin looks healthy. I'm going to do the intramuscular injection on the vascularis lateralis because the skin looks appropriate there too. Now I'm going to prep my materials for the intramuscular and subcutaneous injection. So for the subcutaneous, I chose the needle size 27 because the patient is fairly small and you need the smallest needle possible. And for the for subcutaneous, you can choose between 25 and 27. And for the intramuscular, you can choose between 20 and 25. And I chose to do 25 because the patient, again, is a little smaller. And then we have our vial and our ampulla here, so and gloves and alcohol wipes, so we're all good to start preparing the injection. For the syringe sizes, I also picked the most specific ones because for the subcutaneous, we're drawing up 1 milliliter of heparin, and for the Haldol, we're drawing up 2 milliliters. So first, we're going to start with the Haldol. I'm going to draw up 2 milliliters from the vial. So I'm just going to start with some hand hygiene first. We're going to apply some gloves. Alright. So I'm going to proceed to remove this cap, and then I'm going to take an alcohol swab. And I'm going to sanitize the vial. So we're going to sanitize it for about 15 seconds in a circular motion. Alright, and we're going to let that dry. Alright, so now I'm going to unwrap the needle. This needle is 25 gauge for the intramuscular injection. So I'm going to be sure to not touch certain parts of the needle just so that it remains sterile. And what I'm going to do is I'm going to remove the cap. Now that the needle's out of the package, I'm going to draw how much I'm needing. So 2 milliliters, I'm going to draw that air into my syringe. And then I'm going to inject that into the vial. And then I'm going to take the vial, tip it upside down with my non-dominant hand, and I'm going to allow the pressure will help fill the vial up to the amount needed. And I just have to pull it a little bit more. Perfect. So I'm at 2 milliliters. So I'm just going to remove any air bubbles. just have to inject a little bit more. Or what? Perfect. And remove any more air bubbles. Okay, so now that we have the Haldol all ready, I'm just gonna cap the needle. All right, next we're gonna do the heparin, which is in an ampulla. So I'm just gonna break the ampulla towards me. Perfect. And I'm just gonna set this on the table and grab my syringe. So this one is a subcutaneous injection, so I have a 27 gauge syringe, or needle, sorry. And we're only gonna touch certain parts of the needle again, just to remain, the syringe to remain sterile filled. We're gonna uncap the needle. Okay. And I'm just going to put the needle in the ampulla and draw 1 milliliter without being sure to not touch any of the glass on the sides to so that the medication isn't affected. Okay. So I'm just going to remove any air bubbles. Perfect. We have the right amount there. And I'm just going to recap the needle. Okay, so next I'm just going to label the syringes, each of them for what medication it is, just so that I don't get it mixed up and I make sure I have the right patient, right dose, etc., all the right aids. So I have labels on both of them. And now I'm going to dispose of all my materials that I'm done with in the proper setting. So I have my ampulla and my vial, and the vial is a one-use time, and so is the ampulla. So I'm just going to throw both of them in the sharps container. And then the rest can go in the cart. Hi, Mr. Mancini. My name is Marley Reinhardt. I saw you before, but I'm a level 2 nursing student, and I'm going to be doing intramuscular injection and a subcutaneous injection today. Can I just check your wristband for 2 identifiers, please? Mr. Mancini, yep. And your date of birth? Yep. Good. All right. So I'm just going to explain the procedure a little bit to you. So the first injection we're going to do today is a subcutaneous injection, and I'm going to do it in your abdomen area here. And your skin is intact and there's no bumps or bruises, so it's an appropriate area and there's enough subcutaneous tissue there for that to happen. And then I'm going to also do an intramuscular injection, and that is for Haldol, and I'm going to inject it into your thigh right here. And that is intramuscular. And sorry, for the subcutaneous, it's heparin. So before we do the subcutaneous injection, I'm just going to measure about 2 inches below your navel. Alright, so the injection site is going to be about there. Alright, so I'm just going to clean the injection site for about 15 to 30 seconds. Okay, Mr. Mancini, I'm first going to do the subcutaneous injection. Based on your body center, I'm going to do it at 90 degrees, and it is of 1 milliliter of heparin. Just going to uncap the needle. All right, and deep breath in. Good. Perfect. All right, and I'm going to throw this into the sharps container now. Okay, so next for intramuscular, I'm just going to measure 1 hand length above the knee and 1 hand length. All right, so I'm just going to clean the injection site for about 30 seconds. To make sure that it's nice and sterile. Alright, so now we're going to do your intramuscular injection. I'm going to do it at 90 degrees. And I'm just going to get you to take a deep breath in. Good. Perfect. I'm just going to throw this into the sharps container. So now that I've finished my injections, I put all my needles and all my materials that need to go in the sharps container in the appropriate place. And I'm going to come back and check on you in 20 to 30 minutes, Mr. Mancini, and ring the bell if you are feeling any adverse effects. I'm going to go document your injections now.